Yada say yamwakwa bado Adom TV Nkwa Hia eso na yadobri yebo asenso se ode anwumre kase ebreye eno anwumre nkomwe die ebe me de papa de bia me hu se mo share like comment mo share nso nyame hira mo na ne de no so mepese obi abehwe titiru ne mma no efise ne nkomo no titiru no fama ho na mema nso e wo chefa wo mu news meeting am de ba se na mema nso e wo cervical na say but bibi wo ho a ye bedi hu nkomo nti a ehia se sa nkomo we cervical cancer ya ye di hu nkomo e wo so ba ene bema utie me enti wo waje adwehwem sisi an medasme mo akwaba medi de afia amankwa tamaklo yemfa seda mo aboafo boye chidom coco plus nkura aduane sa akra na nya from 6 months ekwa wo ye aduane bia na wo coco plus ni biguma emankura ndidi kama se ti wo a wo sun na meba mpa aduane no ye anya coco plus ni biguma no bedi asa di biem enti eno no ba bia wo pe bia wo benya bia to St Thomas Eye Hospital when problem bia no St Thomas for sebra no mo nhwema say operation po a ombeye e dia ma say bia wo lens no na wo sesa no ana wani hyehyew ekeka wo hunu nte de ekwase a wankasa Nkwa Hospital ana as a pharmacy shop ko St Thomas Eye Hospital no mo show endpoint homeopathic clinic nso ye do mo ase papa oguso ye screening no de mama ma wa wo de mu ye say wo ho a ye check ne brano emema no prostate no nso Jonas name ebi Abraham mo nhwe mo prostate no so ho unyine no na nu so unyine ti also mo hwe na mo bo ho ban doctor say o check it the free the amount problem ho dia ene na se watua bibi kakra nyuma ko ya daroma eno mbo ya chidom se yemfa Nkwa Hia emro ene eye afia hyose na mene Dr. Benedict Afari Asia ya adwuma afia twa mu no bebre just one friend no obeba no aba educate ye akonya na sa ba biem se ye doctor edi nkomo fa cervical cancer ehu ye be wie no mesra ojoada no akọ check o de enyehu nya fe no bi be gbo hu bia o check ya o na akure na se abo ye hu ban afri sa akokra me hamme ti dog wo ha dog ye mo official pa
me das
afin committee
this is a rare to come
sa na uguso ehwe ye
yes
je ye nkwama ye ma ne titiro so de ma no ho no ana oda
women's health very necessary
sa Dr. Benedict Afari ye obstetrician gynecologist at Woman Probi Government Hospital. Nti edru cervical cancer say ya. There's a guy in one that was say ye fredo near ni di enkomo. Ti dog ya da say so wajebre eni edi enkomo. But even before ye be hye enkomo na se kra na. Sa cervical cancer na e common organa ha. Ah ye record bi.
Oh yes. I think so over some few years normally in a year no almost about 3,000 cases.
Yeah. Ghana na wakana.
Oh yeah, Ghana.
Global.
No, Ghana global they say very more, but Ghana and America no. Usually about 3,000 cases, and about half of them no almost shromonka.
Hey.
Yes. Yes, about half of the numbers now is like that. Even this year, they tell me I'm buy no. It's just around the same. It was even about 1,006. And the cases too, they say almost nearing 3,000. Okay. So it's been like that for a while now. Yeah.
Now say a idea. I was say ye concerned. I was say ye ni kuhu.
Good. Because we have cervical cancer now. One of the preventable cancers. Okay. Once a cancer be wa won't mean ye be anfa, but we dey e betimi ai be
anfa. Okay.
It's important.
Any ehu bi anim. We nya de eba beku obia but ni nyina ne se uhunu ne internal hospital dia sa that's the word so uhunu ne ntam ye be hwe ne ma science a uhunu a obe kase yan ka se ye bia but e bia otuwa no mo hospital na ni for na hwe edu hu djuma e de amaye enti ye ka se cervical cancer no akasa e den
okay enti cervical cancer na kokkroma eha emma. Okay. And service no yeah awode na no. And sometimes you're describing as either the mouth of the womb or the neck of the womb. It's awode na no. Baby moja no ebefa aba wase ho no. And baby bema hu so befa no. Ho no na ye friend service no. Okay. Nti eno ne kire se answer na obenya cervical cancer na say wo service no enema bi eto chema wo ho answer wenya cervical cancer no Into my main can quickly say that means mema enya cervical cancer because a mema no nya cancer. Omuni service. But mboana omo cause cervical cancer different HPV no. Human papilloma virus no good. And only the etimis hani obia. And now here's human papilloma virus now there was so many subtypes. And you need a cause cancer. Okay. And now we the cause cancer no cry now apart from service no. It may cause vulvar cancer. Okay, man or massive honor they way anymore. It may cause vulvar cancer. It may cause vaginal cancer. It may even cause penile cancer. It's man also a bit to me a cause cancer. Penile cancer. Yes. Good. And anal cancer and even throat cancers. It is our HPV virus and an HPV no. A cause nyoma be brave. But high risk types no na it may cause cervical cancer. No can any na into your common subtypes are cause cervical cancer.
Yes. Sisa okay
anal
eno ya de he.
Ina chese woto ho no. Cancer so bitimi aba ho.
Okay. Oba anandi oba
ne be ma nyina se nyin omumienu nyina wo nto moto no bitimi nya anal cancer from this HPV aboya yes a bit me cause
nti na wo se emema no se emagunu nkwada onhu be ma de bo no ho ban emema no so mo ho ban ebedu ho because me kai no emema no be chema le obema de oni service
very interesting my colleagues bi omo urology omo present case 2 case studies bia emema mienu enya penile cancer. And I know so to cervical cancer na no mo che nti ebe full blown cancer no na a check akra pa nti it happens yes.
Okay and then come on e be de pa nti meba Facebook nso na maba be hwe mo comments bibi e kire wadwen wo hobia no o de ba nso a ye be yi ano de amawo nti afei na waba mane ha wo bebre se bia a hye nkomo na se afei kura we ne ye ni animu no a kire ye cervical cancer no achire ye niema ahodo bia ede saa kokora no beto ma wode no ano enti enkomo na fe ne ya hyase afe no abeka ye ho a yesa mu akwa aba Dr. Afra yensan emu akwa aba biem enti sese no wachire ye mu ama ye hunu se ba ne science ana sa de ne course sa cervical cancer
enti cervical cancer no majority in fact say bia 99% no SSR HPV infection unya. Yeah, sometimes very uncommon. Ubitiminya cervical cancer, but yet directly linked to HPV infection. Okay. But majority no the HPV infection in their cause. Okay. What it means is that we come into contact with SARS virus, no. And I say virus, no, one of the main ways how ubitiminya is through sex. Okay. A man and mema endemu agrona omudino. Okay. Obi oha obabi oha na oni bema nhia nso bitimi nya sa HPV infection e bia na oni oba fofo bi. Ana bema nti oba bema. Of course. Okay. Of course. Nti once contact abemu no nti obabi oha onye sexually active. But through contact it be a body contact and answer contact with the same sex obitimi nya nti once onya sa infection no there's a likelihood to obitimi develop a cancer later in life. Most of the time no sa infection most people no omobe clear infection no nti to say just like any normal infection na obenya especially viruses no say onya infection na eno atimi kwa on its own. Nti most of the time no infection obenya all right but ebeko anebia wo fa nduro bi for some other things ebeko but bi wo ha etimi didi umu na cause cancer especially omo immune system no wo form and omo ye smoking omo no alcohol omo nya HIV AIDS diabetes sankrofo no omo these blood cancers. Any condition emma wo immune system no ko form no so that means when you say infection or system into clear infection it will be persistent into be ho ache na ho ache ne there there's a likelihood it will develop into cancer later in life.
Okay, I say kwanya causes no there Be 99% in the name.
And them yes to say we contact with HPV organism no.
Yes. And someone we there neba. How then ye massa no.
Okay, so just like HIV. One say nipa bitimi can so many theories about how HIV came about. It's the same thing HPV, we know it is there. How it came in there, we can't tell, but we know once it is there and it spread through sexual intercourse and body contact and all that, you know. But so will be now in the pakoni share also you get the infection. And when you infection and say o body no immune system no I know nyɛ den sɛ betimi clear infection there. Na wunya types na it may cause cancer na into we or by betimi cause cervical cancer. Betimi cause cancer other parts or other organs of the body. And now we bema cry betimi nya penile cancer. So sanity.
Okay. Hey, yeah, some enti ye fa no say when ya nya no like how many years if you say and a bed done they said you can say baby a bit me ho sa but until yes it be 2 years now but say
into high risk type na cause cancer and sometimes between 3 to 7 years no bet me who changes ni bi e wa wo de na no. That is why the screening is important okay. But most of the time no e bi wo ha 10 years 15 years 20 years and sana good and at the current time manage say most of the time say yes screening na unhu because early yes and I say beginning no asymptomatic just say no signs or symptoms into the unhu bibia until bia enkoye examination bi wo wa so ye hu say bibi I start to develop or I would know
what test na obehu
good because the way I would know baby most of the time when once a man be come to make us say oh I say bibi de be shomase that's the service but once your hand is not sensitive and our fingers no and just sensitive enough to show say oh cancer be and normal until the only way is say oh yeah regular screening and a bit me say okay there are some changes and the changes were started you are the different pre-cancer lesions just say before cancer cancer ebede no enema be starting kakran
yes
of course because we heard the way a development a check answer the full blown cancer no aba yes
I see mama nko enwonam Cynthia se nyamisha ye ne adwuma pa ye ya beto opoku se owo tachiman Buno is and washe nyamisha ye yada se papa mame araba aho kuma wose nyamisha mo ye hwe wasuofu anketia yada se from Pond Junior the second wahala Hassan Nafisa se nyamisha ye yada se Daniel Patriotic and Sonny Nabushi hwe wo Kolebu Teaching Hospital Tyreta Dennis Bell Nyamisha ye Asana Muhammad Wobrekum and was on there or the comfort zone mupa or she love your foreign so Fia Nyamisha one doctor in the topic in it for ladies here that's Ruth of your one so hanana madom say keep up the good work sister Fia na read me comment no na me read Mami Asadi abeg say please how would you know the person you are going to have sex has cervical cancer Mami wa be mana tine die no dog be yi ano chem sakina se monkoso amunya adwumaden Western North no hwe fi Juliana Nkrumah se nyame enhrae yeda se papa enti na ayi but even before ye be yi ne die na no mate se ye se even ase sa HPV no human papilloma
virus
ye se if you remember ho na ekoma ho patwe no kre
so it could come from anywhere but once the way Nyankopon bore reproductive organs I said mano it's like you are at the receiving end. And even if you look at HIV/AIDS, you realize that more women have it than because transmission process is faster and you tend to have more of the organism. But but most of the time, it's like it's the other way around. No just say oba will be a bema intimi. And as HPV no cause another disease I have friend what Your vulva what? Your vagina what?
I mean, cervical screening atlas.
Yes.
Minim the okay be a
Good. Into we
now. What's ya working? Because yeah, discuss here about it. Say what's the difference between way no?
It is our poster we no ya will be a show normal service.
Okay.
Anti service no say the Arabian bound one. Into first two pictures no. And they show the way I would know. Into you say my baby who be that. Yes, into sana would know.
Into when normal no.
These two no, yes.
Okay.
Two no normal.
Normal.
And this other two no. Oh, say they white to say no. And yeah, IUD. IUD family planning. Into say the share I would anymore. String no out. Into wait me crave feeling. Into quickly, my main cancer Saturday way and consider cervical cancer. We say some time back no there were some but it doesn't cause cervical cancer. It will be Ibiana Ukraina wunya where say we ni share until one day be
now
we and the polyps. Polyps I say be a few walk be sometimes a few I would nano and a polyps no create me free. Baby, as was see her vagina, no any other places. In Tennessee, sanity, and when you know the cancer. I may not polyps. Yeah, polyps, no, yes. Polyps. Yes, see it to me if you free ho. Into a bit to me if you free war, I would dare no nimu a pure abonting. Like before, but way inside and sun. Yes, until you can have endometrial polyps. But you bit me so in your polyps, nibia, a war, I would dare not cervical polyps. Nti bi ho na free inside na eba bi so ha wa no ho na say tua ho bibi kokko bi sa sometimes people say onya bleeding on and off bleeding be intermenstrual bleeding it me cause sa
na ede na ye be ye awode na happen a polyps we eba ho no
nti most of the time is inflammation. These are all inflammatory problems and inflammation just o say body ni wo ho trauma bi e bia bibi ko ti ho na repair healing take place na san
no money na
good nti I san
na what you prepare there ho
and there are some cells be so sometimes they just overgrow then it comes out good
okay nti when they also enye
cancer good nti when nyina ahwe ni nyina enye cancer and we so
but before you bedru ho no nti say ekoba ni say ya because the beya men come be nti e bia de ewie no ane ato so nti akoba ni say na we no sign be e na obehu is the same as sebia polyps me dey say minimum the crowd here but e beya to say e bia make say cervical cancer signs be na obehu
okay nti sa polyps no
doctors ne be kire
nti polyps no most of the time no unya this abnormal bleeding
from what age
abnormal vagina it depends it could be say oh, there. I mean, most of the time, reproductive age group, yeah, why not? Yes, yes. Until once I didn't work on it there. Most of the time, early signs of any bleeding. Okay. You may not feel anything. Yes, sometimes very heavy bleeding or light, moderate. Most of the time, one of the normal men who said. A bit me polyps and so when you're intermenstrual bleeding. As well, na moja to and your menses. Good.
And it may last check.
Yes, sir. We say a getting. Sometimes we need ma a besha watch. Okay. Copum say being bleeding becomes heavy. We say obi or bleeding getting to cry on funny serious, but who say hey clots back before we call hospital library man.
It's when that say I can't be see her. Say be a yearly beer or bar was a horse or shiny the MSS young.
Yeah, of course. Inti Ubiko who gynae. Be twice a year, once a year for a gynae to examine you, do a speculum examination. Those things are very important. And anytime you have maybe vaginal discharge, will have any bleeding, I won't tell you, no hospital na yet me examine a pass speculum. A bit me should normally be brave because normally we will say oh into one corner examine we will not see it. Good.
Okay.
It's where na both ends cyst. I know I say in Subi, Ashisho or I would know, but I know nya dear a cancer. and most of the time a banner no akọ enye enkosi problem bia
and no ye and I say inflammatory
if those are all inflammatory conditions that happen around the cervix. Of course, yes. And sometimes we get many infections, cervicitis, and changes in the cervix itself. We say I wouldn't know you will be to say abontin and ecto cervix. There were abontin, there were inside the kaka. There were different cells. There were inside and outside. And sometimes with me some changes there. Into a first adeno transformation as a big word. But the person who say as oban oni no I would then know into sometimes say we said the way a bit good into those are the changes I will why no and yes cancer good
my bro
yes
it's all bra from there I over to us as I see Nkwa Hia and or show Adom TV no cervical cancer home come so far the dog they are sharing any problem there then so day we your bar na wadu bra woni be mehia mu ne de wadu o sex ayi mu no sa no manema we etimi esi timesra mu mientie ne at least twice a year de dog so ko hu gan ni ahwehwe oyem wa wode mu ho no mu no because wa wo ba ko ye de ayi money machines yi be fefa wode ho wa wo mienu yasade aye unsheda nko gan ni ho nko cheke tie de ya said all cancer inflammatory e bia na potwa bi akọ na nyina na do nya sa na ti ohun ti we nya se bia wa yi wasesemu bi na de aba but sane market ayi we awo mu na de sa we mu nyina aba nti yawo efe ho fa ya basa umieni time wate na ya ma awo aye bibi ho na first nka fita mu se wa fa ho nti Jonas ye kan sa wo tena yie nti wo yire wo a ye de ehia sefata ate ase ala nkramofo no ya na wa so ka so mo na te wo mo te ade na se ti na ntwi otu aduane osu ti munya ma na sa ebi munya na sa nti point sabra no wa wo de no hwehwe mu mawo ese ye hwehwe sa de 2022 de ye nkwa no an ye bo ho ban ti frɛ point was 0244 867068 0244 867068 brand one check wa wodi mu mawo se bibia ye kama na ne yakwa anim don pacho me samu akwa aba ye nto so na me be odi abai de nkwa ye the condition we de rade man
good into cancer nankasa number 1 intenumpo de untimi describe it because hona e basa
and then before be do when de na sa show much
of course
na say when you bleeding be one report say
yes when you pre-cancer lesions be when we start bleeding be mfanye bibia anti ebedu hone de na aye too late advanced cases in there na aye too late
and then you who be
yes most of the cases we get they are advanced that's why mortality rate near high because we have number of cases now it's about half because omunyi na omo ballet in there you can't do much
the reason is saying I mantem
is the culture and abuse until even anything about cervical cancer until and can you imagine even in Accra there are some women mobile consulting will be some say oh have you heard about cervical cancer most there be now be saying so test and perhaps why you be that so there be
and so you can imagine
you see into villages you can imagine and even some people who say a man baby unsa wodi na no ne wase ho ne de na say some people cry taboo mom nti bibi kura cause for kronka nti ebe ko chipa
this year they also yes
and so you make sure say screening it there we are taking it very
from dabekra yes
so Monday to Friday. You know, this whole January, even into February. Yes, into February. But the rest of the year, they'll be to me, but just that the January and the February at a discount.
Yes. And will be a bit me, maybe I made a number better.
Yes.
Now, you know, check me and I'm checking me as I'm bit better.
And no,
questions. We might be via. I know I can't or who you actually.
Good.
Doctor, to where you no be only free.
And I will share other pictures in the soa. Omo munya sa early lesions no and pre-cancer lesions no yetimi ye treatment emomo.
Oh, okay.
Yes, inti treatment no is to stop the growing of those abnormal cells no. Inti obi wo ha ebe what we call ye freeze cells no. Biso yetimi use jam from ma biso ho kra yetimi ye operation na ye twa part na aye problem na ba ho. Good. Inti when we hear our treatment, and this is how it looks like.
Oh, okay.
Okay. And as other pictures, no, so you will test BFNO, visual inspection under acetic acid. You use vinegar.
Hey, vinegar na go you.
You know.
Vinegar. I see. Oh, sir.
It's so what the no that testing is quite cheap and easy.
Okay.
Into what is smear honor, it may pick certain changes are. A bit me more idea say cervical cancer no started good teno so boapa into who sa normal fita na who say no things are not going well and we need to do further tests further examination and decide to do treatment and now say stage you know then we move on.
Nti ya who can ya who stage you know.
Yes.
On say there condition be kra na e be a kidney.
Yeah, kidney stages.
Inti
good. Inti no stages no all severity. Inti e first stage 1 I was just around the 7.
Like me ka say and also stage in the ka.
Good. In the same yes.
Because he say stage 4.
4 good. Okay. Inti the same way no it depend baby aspirate akodru na ya ka say bi inti o here stage 3 4 ni there. This akonenim. Okay. Good. It's just the same.
3 and 4 ho no. Ye bantama mutime boa.
Obi o ha ebetimi aye bibi. But some people too they may especially more 4 ni there. 3 is ako nimu pa but 4 there ni there. Especially 1 and the 1 in the bi o betimi 100% cure. Okay. 1 but 2 subtypes no echo 3 4 ni there. Na sometimes we'll start the treatment will be a an operation you be man a draw you be radiotherapy obi obetimi nyin kakra 5 years survival rate no betimi akwanimu kakra obi living a life we planning and sana owo no aba won it's better say be to perform na won prepare
one woman be 3 years or so ago I don't know a case study na owo bi aye treating and ho aye no den no ho atoro kra o hwe ne ba o then me wo ho aye so afrim
you see
the picture that so ho na me say no bi an ho den ti den ne ba ye because dog say yetimi say the wo kan na just say e bi say 3 4 no most so an kra na no matter what
sometimes it is spread the other organs no that's na death because it be a cold heart and a bone brain the NHS
it is cervical cancer
and very preventable because of the advanced cases they don't see it often but has the advanced cases in the because we've not taken the screening seriously before the saying that we don't take it serious but this we can
say as a month and a honinti
and out education from March
March February 1 not for shame
every time there are new information and at this point let me give credit to Dr. Kofi Efa or Batok Catholic Hospital Omona they've done a lot of work concerning cervical cancer and more come out with these images and the call for educational we're in our talks now it's really helps
minim adofo aba hasisi ani bisa Evelyn Nightingale say please can cervical cancer kill
of course
Canada yes. And Chem Sakina said I have the same problem how can I solve it dog aka same problem say cervical cancer na
other
symptoms be they said there be a
sporting pose into excess symptoms no cry no yes boso
okay this say yam ko ho na ansa na abeyi bia no because say mo the same problem I be enye no na o be hunu ho
okay early stage in there unya symptoms bia until started say unya symptoms one of the first symptoms say bleeding say when who can for bishia na who moja your friend postcoital bleeding.
Okay.
And answer the friend intermenstrual bleeding no. Or how was who moja and your menses no moja.
It was also say na SM your concern.
Yes, any abnormal bleeding is of concern. Because you can't tell say a way and a way. Any bleeding be any normal for you, no. You have to go to the hospital for thorough examination to be done. And as I caught nenimono, which means severe back pain, low abdominal pain. Say binimo how munya was a thing be a winya pain. Then one thing to say, omo munya cervical cancer kone nenimono mutiminya this offensive vaginal discharge. Say in Sione from Wasebano. And was some and then was some peculiar scent. Unya hunya no say no. We did a subset. Sometimes or more advanced stage or more emergency. Yeah, by examination. You get the whole thing.
You know, smart and
you can imagine. Offensive and as a friend malodorous vaginal discharge. This pungent smell. Then sometimes or more edidia kumuno. For example, maybe a didia ko baby a Johnson a koguna ubitimi enya hematuria just a emoja ojunso emoja wom. But let me say there's another condition be a friend junso moja and also so can affect the service. And also peculiar changes as yes speculum examination now be. But if not cervical cancer did call blood anymore bit me to toklu I'll be nya fistula into bit me vesical vaginal fistula, not the one free obstetric cause. You is from cancer. And now so bit me rectal vaginal fistula just say baby sabi tifino if you been say bit me about good. And of course a spread baby your kidneys no baby Adom you can get very bad low back pain. And then of course I call baby your kidneys so bit me kidney failure. A call chester, a chest infection, a bit me cause a problem. Sometimes can even spread to the brain. Into depending on baby, I spread the it can give you all manner of signs or all manner of symptoms. Yes.
And yet now, Sakina na say so the yak can be na Mr. Weno, Yami Adoma Monday say na ya call BJ Medical Center say our year screening no discounts. Nti so ya no wa hye no so ama me. Na from after February hon more ekone de ya nkone discount. Normal charges na we are a month no I cervical cancer month nti one more so. Obia kone ko check. Netie the doctor no be ka kire. Na afi watu ho anamo. Nti do patro yemra pap smear no so.
Good.
Pap smear no so.
Nti screening tests there were various types of screening, but the main one is the pap smear. Pap smear no I know the and say service on cells wo ho. Into fast cells ni bi na they collab akohwemu. Into normal mienu na ye find out. E pese who say changes bi a start wo awode na no. And now say embo na HPV no. Types need me cause cancer and ebi wo ho. And then no HPV test. Into we pap smear test with me HPV test and a combination of the two. And I bet me a visual inspection no and bet me give ideas say okay changes be as starting to any colposcopy and I take a biopsy then we take it from there. So the screening there is very very important because say it may detect pre-cancer lesions na early lesions a bit me as on term so that it doesn't go to become full grown cervical cancer. Ehia
pa nkomo we enu se ne ba ne se ya yesa kwa monten so ne abusa Ghana for yaje wo mo so adwena nye bia cervical cancer na dog ka no obi ba betene ni mo so na ubusa na wonte da me blame obi a ye kra ye wa hai kra no obi akra ubusa no kra no wonte me enkotie de omanfo bi eka ye Pamela ye boa ene bi ekasai.
official pa afi ansa na mesa ne mu edi ehia biom ene me de wo bepie mu e wo Kaneshi market ye bi so omanfo se cervical cancer eye de anya adwenben ene wo fa ho eye kokram a eto ema wo de ano no adwenben ene se ye bodin a eye oba omanfo tirim ye bi so omanfo bi na ye ntie de omo so nim
cancer na aba mbaba wanem emma ya wo de ano no ni na efi ye mba yiwa yesi so na ye course ye kofamba abayo bi wo hono ma ni nsa left and right ni awa hye ni nails ordinance na hyehyɛ so ho ete say sabe sasabon sam ni ro ordinance na hyehyɛ ntumi ho nya na mu yie no de nyoma especially baba wani bi no so omo de nyoma hyehyɛ omo ase omo de nyoma adura eni se omo de hyehyɛ omo ase na omo de hyehyɛ omo ase no mo nim se ni na no na nam so de sa yale ne ba enti me nua baba wa ne mba yesi so a ya pepre ya ho petepetela bla bo ayebo obi an hwe ne ho ye ni nua enduro bi a eni se oba de hye na ase no de hye na ase mo de hye ya ase no eno na de sa ya sa yale ne ba abawa bi wo ho na ho se bonya sa yale ne be to me kan tam ko doctor ko hospital no mo hwe ma na ankoye ankosa bibia e wo ho nti obetu me kantam obeka wo ntam wo ko hospital ni na echi no ano se wo abai wa wesi so be hwe ho ye anante ne sa anwema na ye de hyehye ye ho no na ma ne mba na ye de ye ho hyehye ye ho ano so kan nti ma ye hwe ye ho ye ewo mma ya bla bom ne yankasa ya bla bom ne ye ho ntoye
de minim fa na say ene de ba ho a enti say cancer na ye ba hu no ntem ene ye didi ho kakra especially ye ma no e ba wase a hu ne ntem e di ho kakra sana abedi spread e ho
wala minim say ye bi a so wo hu ne ntem a edinsin so just a wodi ni nyina timi say wo hu ntem dia onyame ne doctors Adom otimi dan no ase ni nyina nkokora o ma nya ahoden a ebeboa wo anya cervical cancer no nko cancer no for that thing but then that of the breast it can be anywhere it can be anywhere. I don't want to talk much about this because I'm a survivor of breast cancer. I think I've been a survivor for more than 10 years.
I don't know. Say, be a basanwa. Wow, bed and say, betcha and some wow. Yeah. Who send a mention, Sanya? Ebia wodo nsaka won se eye wo ya na te se ebi wo ho ana wo msane a besi etwiti
emma ebinom yusu nuro hyehye yase ntimi de no na eye madwene se ekofa saa yare ne ba duro bia obeti se ye ton ye kire ma ho ayese no na akoto no de ahye nase nti nuro no ebi ye papa ebi so nye unim bebi edi fre nti se wa nhwe ne yie na wo ye wadwen se u ma ho achi ama be ma fa ahisi ahwe akofa yare bi ama ho ti mi mom die di amemi di bani ehu amaten ebi ni sa kokura ma etom di agi se wo ko hospital se wo ko na doctor test na wo hu se ye no a wo hu na treatment or so the man na bebre survive ebi nsum survive because ebi mu ho a aya no mu nyi ni se hospital yare na ebi so a enuro na de ebeka so onto no na ho odi ntimi tinu aya ni so ma me kwaya ni fam duro sa anko fam so enche no mawu but wo ye wadwin so be ma doctor treat wo dia ene enyame ye wadom a betimi a survive
ni sa edin pa na wo hu ni tam na wo ye so a wo ko hospital ye treat e be fam onu ni asam se ebi a bleeding ye mo a e wo so hu doctor
kanehifo bi adwenkyere ene yakwa kohwe ebi kyere ekwanya kokroma eto ema wodi ano no etumi ba ebi so kyere ne se oba wo hu se wanya sa yare yi bi ekwanya wo se wode fa so medin ede Pamela Yeboa betumi afra me prem to bre efia mankwa wonto aso
Yada se yama wakwa babimti Pamela no ena yete no enka no miento so dog na mensan emma wakwa babie me ye sure se nkrofo bebre mo sound no emma no ya ha de ne sound no banti mesre mo bia YouTube sa restart and refresh no nembra madam wase papa mo fanche se sound na bibia ho Rosemont appear se Dr. Rosemont and her husband wo mo share osinya mi share da Cervical so se ene topic ne die eye pa beboa pa asana wo brekum na ono so hweye yedam ase don pacho na ye wo hia me se etiefo no
yes
ebinim
at least omunim se one contema betimi how and they have an idea say I did a show on hoche that's why now no screening na you make sure say you're very serious about it. Yes.
Into the treatment and so yenhwe obi ba ho no mu a ana complication wo ho yenhwe complication.
Yes, into complication no basically no wo bibia ade no echo and no stages no. Good. Into and then this are complications in but depending on the stage. But I started their initial stage in there, there's no problem per se. But say you spread then you get all the complications. I wouldn't say vagina also will be affected. As I would be affected. Bladder no. All the organs will be affected. You can imagine. And even other organs will be affected. Inti yetimi catching early. Na other say in terms of treatment be or depending on the stage a bit me ya would any starts good. Once we take the uterus then it's gone with the service into no say spreading ko baby there we I would no nyina I would no anche even after that no be or to be double sure a bit me the endro chemotherapy drugs account and obi so depending on the stage and no radiotherapy na use the almost share machine mo jam from kill cells yes
see no yada say na complication no ni treatment no so
good into treatment especially with the pre-cancer lesions and the enya good and on into ya na ye different types of treatment ye cryotherapy and no exercise a freeze cells no say cells no omo be abnormal and omunyi intimi control so you freeze the cells this is where thermal coagulation what the jana or the year this was surgery that affected part no ye free good into these are the treatment modalities for pre-cancer lesions but for full-blown cancer depending on the stage you bit me ya what you bit me chemotherapy you bit me radiotherapy or even a combination of all the three.
Okay. Na matese enkura omu maywa ne mema omu ne be menhia no omu ne obanhia ye. Omu se etimi bo omu ho ban free cervical cancer.
Good.
At what age? Na ekwan be na mo bo omu ho ban.
Internal no primary prevention no. Primary prevention is no contact and a protector into ages 9 to 14 into for both boys and girls because when you say obema ni nya obetimi dia ma oba into protect boy now you are protecting the woman and ono ankasa then if you protect the girl that means you are protecting her own future into between 9 and 12 14 years no you betimi ama boys and girls no vaccine be for primary prevention.
It is a vaccine you prevent you from there because obani be because you preventing from cervical cancer. It be man you preventing
penile cancer. Any other infections and cancers as HPV no say an HPV vaccine good into any problem as HPV vitamin D especially the high risk ones because the thing is vaccine so yentimi enya vaccine all the types of HPV etimi eborn into we have especially the high risk types na causes cervical cancer into we to say vaccines mienu into bakubia wo bia bi about 2 of the ones that cause cancer no eborn ho ban another vaccine so etimi bo about 4 of the ones that cause cancer no into say if you get any of these vaccines at least it will protect just like all the vaccines na ejuma na ye no it protects you from acquiring the infection in the first place.
Hey, madam for me say mutie ni ye obi an kobo ho ban na okay intina say mema no matre attitude no mo use machine de omu hia ban bo mo de ne prostate no.
Yes, and the thing is you see, for you to get the results that you are looking for, it's better you catch them young, as the saying goes.
And they will last forever. No, that's one
good, but for embano, particularly for cervical cancer, because we are dealing with cervical cancer, no. Even after say, if you don't get it, time away corona, and that time you are a virgin, but you've even gone ahead to still be sexually active, we can do the test. Do the HPV, make sure say you don't have it. Do the pap smear, then we can give you the vaccine.
Yes.
Yes. So we are doing screening, and all those who are eligible for the vaccine, we encourage them to take the vaccine.
Vaccine, you want to know how many times?
3 doses.
Okay.
Into your spread it. First dose, we give you time for a second dose, then a time. So 2, 3, be 2 months, interval be 3 months, then 6 months, then you are done.
3 times, so it is a what's vaccine? My pap smear, my ear women, and I'm a vaccine now. Am I safe that I don't need?
You still, once you are still in the reproductive age group, you've not gotten to pointer any say, yes, stop screener, you can still be screened. Because there's still a chance, because when we say vaccine, it covers specific types of the HPV. So what about the types now the vaccine doesn't cover? No? You could get that one because you are still you are still sexually active. So we still encourage the screening, the modalities, for even those people still to be double sure. So depending on screening tests now, so we have pap smear and 3 years. But we pap smear plus the test and HPV test, and then about 5 years. So it depends on the test you do. Then the doctor will give you the time you have to. But to be we may have to follow up on a regular or maybe yearly basis, depending on depending your history. What we find, they will tell you that okay, you have to do it after 3 years. You have to do it after 5, or you even have to come earlier. For us to continue with the follow-up.
Okay. And one on no opportunity in here, say yeah discounts war BJ Medical Center because you was cervical cancer month muntino mesro or baby I will show me about time bema krana war or ba you are na be mo when you're 9 to 14 years no young komo war vaccine be prevent or mukra de free home yen so ye active no yen so say na say ye pap smear no okohwe say bibi wo hono mu a bibia ni ho de announce wa vaccine no 3 times dose no na say ne won so no nti say the dog chire mu no say 2 years a year na wo so ba for say e be your pap smear bi ma na say e be your de no ni nyina e wo ho nti me so number ni ne WhatsApp especially say bia obebuki ana bibi no 0266 808941 0266 808941 0266 808941 ana se bia wo pegan ni na ankasa na ne di nkomo wa wo personal dia wo pese wo chechere ni ema ni so na then wo book no so a 0243 903104 0243 903104 na chese no so organic special one amede na ma wo no wo frɛ no but make sure say wo frɛ no 12 midnight ati ase ho de ede awada nti ene WhatsApp ni mum send na anytime bia gan ni phone de bia omoje awo hwe man nti bia no wahu send ni message a obeboa ana BJ Medical Center for so we book no waba ni ayo test no 0303 970 898 0303 970 893 and 0303 965751 na screening na ye on discounts from this month call February no na say we discount ni ye nyame ya adom na January and February kakra bi a discount ni mo ti ebo no so de ye je no sa pepe opportunity ni nti eno ano no mama na sponsors ase St. Thomas Eye Hospital wo problem wo wani a yenko St. Thomas Eye Hospital no muaye Coco Plus nkuraduane from 6 months wa wo ba 6 months ho kwa fa Coco Plus gumma no e mankrani didi say bie na numa oji aduane bia wo de be ma no Endpoint Homeopathic Clinic and so boye 2022 ene etoso 15th ene ne yenya 15th January yenko hwe bra no onye screening ne ma no ene nkoma ye die se wa wodie no mu yenhwe se wo haw bia ne huntu betimi anyi sen awoafa ho afa oba ana infection bia ne ho a ebedi de mu de wakọ cervical cancer bia dia ene ye endpoint emema no prostate no so sa 0244 867068 0244 867068 and our friend will guide you 0243 903104 medin e de afia amankwa tamaklo meda promtobre ene Audrey na eye ne birthday yedanase oni Jennifer AB ene akwa ne Jonas munyina aka ho yedo bia semedin de afia amankwa tamaklo weba kofi ampedu happy birthday enkoma yekọ ahosepe black eye etwaso